Hey, so I did my presentation and giving my paper on motivational interviewing with adolescents. I chose it just because I thought it might give me a broader view. I originally started out with um, MI with criminal justice and just was struggling, but I actually found quite a bit of content with adolescents. So let's get started and see what all I found. Just a brief overview, which we all know, but the creation of motivational interviewing was for substance abuse counseling in the 1980s. Almost every single or not interview, every single article I found said something about the creation having to do with substance abuse, and just sort of morphed from there. And I thought originally that when I started researching everything, I would find a ton about like MI and substance abuse, and I just didn't. And maybe it's because I wasn't exactly looking for that, but um, the reasons were to have the client making the decisions and leading the charge. That's a very basic way to say it, but we all know that we go through all these steps so that they can make the decision for them, and we look at each other as partners instead of the professional and the client, and the professional knowing everything and then the client just um, learning. So we want to see each other as equals and just working with each other. And mostly the client is um, the expert because it is their life that they're discussing and that we're trying to make changes in. So partners and not one above, one below, I guess. So I took this screenshot from the Miller and Rolnick text because I thought it was really important. So looking at motivational interviewing is all about acceptance, and absolute worth was one pillar. Each person has potential. They're their own individual and they have their own story, and it is all about them, which seems really selfish if you're not looking at the context. But we're not worried about anybody else. Like obviously we'll hear about other people, but we're looking at the person as the most important pillar of everything. Um, Accurate empathy, so we need to be interested and a vested effort to see this person's point of view. So we are the passenger seat driver and we're looking at everything from their perspective, and then they're the expert. Autonomy support, so we want them to lead the charge and see where we want to go. And then affirmation, look for and acknowledge a person's effort and ability. So we're looking at their strengths and trying to go from there, which I think is all of social work. We're trying to do everything strength based and evidence based, but motivational interviewing, especially, is we want to look at what they have accomplished and really highlight that, and then what strengths they have to build upon that. Um, the concepts of motivational interviewing: engage, focus, evoke, and plan. We want to grow the clinical relationship by working together and establishing that rapport, um, not wasting too much time. Obviously, we want to find that good balance and get to know the client. Um, the next step is focusing. So, finding the point that we want for the sessions, and that client is the one who's going to give us that what they want to focus on. And we could write our own little notes of um, excuse me, sorry, I'm trying really hard not to yawn, of like ideas that we think the client might want to talk about, but at the end of the day it is their time that they're giving us and we want to try and work on that thing, unless it is obviously there is some instances where it's mandated for them to be there, and I want to make sure we're following all protocols that we need to. So evoking the why and the how, just why do they want to change this and how are we going to do that? And then the plan is how to change. So we're going to set out, we're going to make that plan, and we're going to do this together and we're going to figure it out and go from there. So the use of motivational interviewing with adolescents. So I went through and I was trying to keep everything very broad for a while and then narrow it down and see what all I could find. And the main things I could find um, research and articles on was these 5 things. So the use of it with offenders, substance users, behavioral changes, weight, which was kind of surprising, and then in the government systems, CPS, DCS, everything like that. And there was a lot of overlap, especially with the offenders, substance users, behavior changes, and weight. So offenders and substance users, I say it a couple of times in a few slides, but the offenders and substance users a lot of times went hand in hand. And I didn't use all the articles that I found for the whole paper because I found quite a few and wanted to have enough content, but um, most of the offenders have a substance use problem either in the past or present. And then behavioral changes, like all of these are behaviors that we're trying to change. Like the weight was about obesity in youth. So they're all behaviors that we're trying to mold and change and for the better of the client. Um, and then behaviors, obviously substance use is a behavior, and then offenders in whatever way, like they have done something that in the eyes of the law is not correct. So it's all behaviors that we want to change. And then in the government systems, it was actually surprising what I found in there, but we'll get to that in a little bit. So with offenders, it was the second easiest thing for me to find. So most of the studies were based on training the professionals and not really research on like outcomes, which I do have in a second. But the studies that I did find were found to be implementing these practices was successful. So, and it wasn't all exactly like what we're seeing in the book, but it was all very similar. And Miller and Rolnick was referenced in almost every single one of the articles that I read through and saw. So obviously, Miller and Rolnick know their things and are a really great source for a lot of people. But so in one of the um, articles that I found, so the MI was needed due to the offenders engaging in negative behaviors. Obviously, they have done something that has landed them in some sort of prison, jail facility. And one of the articles I found really interesting, it broke down everything having to do with the prison system in the past. And I mean, if anyone is on social media, you're gonna see like how prison you would think would be for the rehabilitation of the people in prison, but in all reality, it's not always that way. So that article really wanted to look at doing what prison was intended for, and that is to rehabilitate. And in other countries, that's exactly what they do. They rehabilitate the person or persons in there to reintegrate them. But with offenders, it was very easily related back to the original use of motivational interviewing having to do with substances because not most, several of offenders in prison did have a substance use problem. So the study suggested a 21-hour training was deemed effective in increasing self-efficiency and motivation to change past behaviors. Um, that's pretty awesome. I can't remember, I didn't put the exact percentage in there, but it sort of makes me think like, was it that much more effective because that's all they really have to focus on? They only have so much to do while in prison, but it was an interesting thing to ponder for a little bit. And then another article was a brief intervention can reduce adolescent substance use in previous offenders. So a lot of surprising but not surprising, adolescents had issues with substances. So seeing that it can positively make it a change is encouraging, especially for how the world seems to be going recently. For substance users, like I said, this was pretty similar to with offenders, but MI was used with youth in the specific articles I'm discussing. who were already using illegal substances on a regular basis in London, England. So I did have some articles that were not from the States, but the training was used to emphasize and develop the skills of the client, which is a big part of motivational interviewing. The studies found that the same as the previous study, it was found effective with a previous offender who had had substance use issues. And then the benefit was found uneven in one of the studies across the behavior studied. However, youth that received the MI were almost 4 times more likely to change their substance use habits. So good and bad there. But it was pretty interesting. And I think there was another study in here that they found no effect at all. So it's different to me to see how it can be one way or the other. But so for general behavioral changes, I didn't know how else to really label this, but it is mostly based for healthcare workers, and I don't know, it's just very interesting. So most of these articles were addressed to healthcare workers and parents. One of them I found that was literally written to parents. It was a doctor who wrote it though, so I felt it was appropriate. But I never really considered motivational interviewing in the home. But it was very, very interesting. But these were to assist in healthcare workers or parents, the use of motivational interviewing in the office or home with a child or patient. And then most stated that MI was not always suited for a busy work office setting because it does take time to use these methods, but the key aspects can still be utilized efficiently. And then it's always still maintaining a patient-centered practice. Um, so with parents, it was more obvious than I thought. So I mean, you look at it and you're like, okay, it's almost like gentle parenting. I don't know if anybody's seen that, but you just look at it and you're like, okay. The gentleman described it like, okay, how ready on a scale of 1 to 10 are you to help me clean up your playroom? And they give a number and say 1 is not ready at all, 10 is like, I can go do that right now. Say he said a 5, you would ask, okay, why were you not at this? Why were you not at a 9? So it was very interesting to read. But with healthcare workers, it was just looking at a lot of times now with pediatric um, physicians, they're looking at more than just their physical health, especially with ADHD and some other psychological issues. When you look in the DSM-5, a lot of times it is just a regular physician and not a psychiatrist or someone working with them. So it's very interesting to read, and I was honestly very entertained. It was great knowledge to have, I think. But for weight, this was looking at children with issues with obesity, either coming up or they're already battling obesity. So similar to general behavioral changes, I just sort of had it separate because there was more for this, but it's modifying office use programs that these offices already had in place and then adding the motivational interviewing techniques. And then the feedback from the study participants showed that significant changes proved to be successful in the office setting, which I found pretty interesting. They used different age groups of kids, and then obviously there's some that just didn't respond back to the last survey, but it seemed to prove to be pretty successful, which was exciting, especially because these kids were, I think, between 3 and 7. So seeing is like a reduced amount of snacking and hopefully setting up some healthy habits for the future. But in the government system like DCS, I just didn't want to generalize it. These were almost all professional centered articles, and they showed when it would be best to use motivational interviewing methods, as well as giving some training options. There was one that I think was mostly like a informational article, not necessarily, which that sounds kind of dumb, but not necessarily like an article we would read, but for professionals that would be handed out at like a seminar or something. But another study found that with a 12-week program, no significant changes were found when working with parents in a family welfare outcomes. So, I mean, that's a longer training program than I think some of the other things were, but they found no difference, which was kind of crazy to me. But hopefully they're able to, or they looked at other ways they could change things and maybe move forward. But it's super interesting. But here is all the references I use it. I'm sorry that the type is really, really small. But if anybody would like to read any of the articles, please reach out and let me know, and I'll be happy to give that to you. But I hope everybody has a great week, and I will see you all later.